Hello, I'm Christopher Hirose with the Coughlin Clinic here at Saint Alphonsus Hospital. I want to talk to you about hammertoe deformities, which we commonly see here in our clinic. So the question is, are toes really that big of a deal? Well, we have a really good case report. This is someone who is in Poland, who is an avid mountain climber, and he developed gangrene of his toes to the point that required amputation of all of his toes. And so you could see that right in here. But he studied himself, and he noted that he had a problem with this. So one of the issues is that he had a problem with walking, and his gait velocity was diminished. He also noted that his step length was less when he walked. And then lastly, and more importantly, he felt that he might fall down because he couldn't have the stability that he did beforehand. And so the question is, are toes really that big of a deal? Well, yes, they're absolutely a big deal. Now with hammertoe deformities, they're very common. We see these very commonly in the clinic. And what's interesting is that with women, we see it maybe 4 or 5 times more than in men. And it peaks at about the 6th decade of life. And it could be a major problem for people. So the causes of a hammertoe in modern society, the main cause is because we wear shoes that are too tight and ill-fitting shoes. And we see them in shoe-clad societies, whereas in a society that does not wear shoes, you rarely see it. A second cause is diabetes and neuropathy. So people who have diabetes, sometimes their nerves malfunction, you'll go numb, and then the muscles have a differential overpull, and it causes claw toeing to occur. And the last main category are these more rare diseases, something called Charcot-Marie-Tooth disease or even multiple sclerosis. The reasons why toes hurt, there's several of them. One is that a deformity can cause a callus, like you see here on the top of one's toe. A second reason is that the deformity gets so bad that it starts to hurt, and this comes in 2 separate varieties. One is a stiff toe and one is a flexible toe that you see right here. And lastly, if a toe is so stiff and deformed, it could get infected, and this is what we want to avoid. This person has an infection on the tip of his toe, and it requires an amputation of part of the toe. So here's someone with a painful callus that is very painful, that we've shaved off in the past, but it just keeps coming back. Here's someone with an infection that required a toe amputation. And here's someone that had claw toeing so severe to the point that he had to modify his shoes and cut out the tops of the shoe so that it did not rub on his toe. There are some people who come into clinic that just cannot walk. Now this person has severe claw toeing on all 10 toes. You see it on both sides, and she just can't walk because she hurts so much. Now if you happen to come into clinic and you have this problem, we start off conservatively, and it's good to try to get you away from a shoe like this, which is constraining. Your foot will take the shape of the shoe with enough time. And so we want to graduate you from a high-heeled shoe with a pointed toe box into one that has room for your toes. This is an extra depth shoe which is tall from the top to the bottom so that your foot and toes will not rub on the inside. Now there's a lot of different varieties, and we tell people who come into clinic to do some shopping to pick a shoe that is comfortable for them and their toes don't rub. We'll often prescribe a toe pad. This is a silicone pad that will cap a toe and prevent the skin from rubbing on the inside surface of the shoe. And then we'll often trim calluses. So if we trim a callus, that often helps with pain, but it will come back unless we address the root cause of the problem. Now, if you were to have a claw toe deformity or a hammertoe deformity and fail conservative treatment, then one option, if you're a candidate, is to turn to surgical intervention. I want to go over some simple definitions. So a mallet toe deformity is a toe deformity that is bent at the distal joint called the DIP joint, like you see right here. A hammertoe deformity is flexed at the more proximal joint, the proximal interphalangeal joint, like you see in the image, but that would be a deformity like this. And then you'll often hear someone with a claw toe deformity. So this person is bent at both joints, the DIP joint and the PIP joint, but they're extended at the MTP joint. And usually it's all of the toes that are involved, typically on both sides. The surgical treatment is similar depending on the type of intervention that's performed, but in general, you will have a small incision over the top of the joint, and then we need to decompress the joint with resection of the bone of the proximal phalanx, and then stabilize it somehow, typically with a Kirschner wire. This is for a hammertoe deformity. The procedure for a mallet toe deformity is very similar, in which case we make a small incision over the top of the joint at the distal joint, again remove a small little section of bone, and then stabilize it with a Kirschner wire. Now this has been done in the past with good results, but what we notice is that some people will have a recurrence, and so lately there's been the development of these devices that are left inside the joint. This is a nitinol implant that's implanted in the joint. Here's an example of someone that had this type of surgery, and you could see that that toe is straight. Now, some people will have a tear of the ligament underneath the ball of their foot. This is called the plantar plate. And when this ligament tears, then the toe will rise up. And so in certain people, we will often consider repairing that plantar plate to hold the toe straight and down. Now, your recovery from surgery like this is typically a same-day surgery. We bring people back for a wound check and then remove stitches at week 3, and we'll often start physical therapy at week 3 if your incision looks good enough. Typically, we'll remove a Kirschner wire at week 6 and then start full weight bearing. In that entire time frame, you're in a postoperative shoe that looks like this, and then at week 6, this is discontinued and you go to your normal shoe. So in summary, toes do matter. There are a variety of hammertoe deformities: the claw toe deformity, the mallet toe deformity, and the hammertoe deformity. We always like to start off conservatively, but when this fails, and if you're a candidate for it, then we could straighten your toes out with a surgical procedure. Thank you.